Good afternoon, everyone. Thank you so much for joining us today. My name is Judy Blake. I am the Leadership and Advocacy Coordinator for Family to Family Network. We are very happy to have Dr. Natalie Montfort, clinical psychologist with Montfort and Associates, joining us today. And she is going to be talking to us about talking to your child about their diagnosis, what to say and when. And I was so excited when we started having these every other Wednesday virtual trainings, because having an adult son with autism and other co-occurring disabilities, it was always challenging for me. He is now 25, and it was always very challenging for me because you never know when quite to say and what to say and when to say it. And as I'm sure Dr. Montfort will tell you, there is no magical time and there's no magical way to say it. But we know so much more now than we did, 25 years ago when I started doing this. And she's here to share with us her personal knowledge and her professional knowledge. So I'm very excited to have all of you join us. We have a wonderful array of family members and school district professionals and community members joining us. Many thanks to my colleague, Christina Zavala. Thank you for waving, for helping me make this happen. Love you, Christina. Could not do my job without her. And Family to Family Network, just so you know, we have been in existence for 30 years. We are celebrating our 30th anniversary, and we are having a celebration December 3rd. Our website is familytofamilynetwork.org. And so we are having a celebration December 3rd. There is a survey link in the chat box that I would like everyone to complete at the end of the presentation. Please hold your questions until the end. And Dr. Montfort will be presenting for about 40 minutes, and then we will take all of your questions and hope to have as many answers as possible. So Dr. Montfort, thank you so much for joining us today. I've known you now for, I don't know how many years, but it's been a very long time. And I'm just so honored and thrilled to have you. Thank you so much.
It has been a long time, a good long time.
A very long time.
Thanks, Judy.
My pleasure.
So today we're going to talk about talking about the diagnosis. And just to give you a little bit of background, so I talk to parents about talking to their kids about their diagnosis or their condition before I really had to do it in my own home as well. So I have some older boys who were adopted at older ages who have different diagnoses themselves that they didn't know of when they were younger. So I started kind of getting the questions firsthand, and also had the experience of not being able to bring them up kind of knowing with these ideas or strategies that we're going to talk about. So don't worry if you're thinking, oh my gosh, my child's 14 and I haven't said anything. I was in the same boat. I talked to people about the ideal way to do it, and I found myself in the same situation. So we'll get through it. We'll talk about some what ifs. Please hold your what ifs until the end. If you have a different question, you might type it in the chat and I'll let you know if we're going to address that at the end or not. But any of the hypothetical, like what ifs, hang on to those till the end because of just the kind of concern or different worries that we might have with these sensitive topics. The what ifs can get a little unruly. But if you have a different question, particularly about something that we're talking about in that moment, feel free to put that in the chat. I will do my best to watch the chat as we talk, but if there is something in the chat, Judy or Christina, if you all see it, maybe wave at me or help draw my attention to it, because I have a couple.
Yeah, I don't want you to lose your train of thought, so we'll probably hold them till the end.
Okay.
Yeah.
Let's see here. So if you have a question too and you want to show your face, we could have like a real human conversation. But by all means, you don't have to. You may not be wearing pants, and then definitely don't turn the camera on. But hopefully y'all made it here today. So we're going to go ahead and get started and talk about kind of what gets in the way or why we even talk about this subject. And that's because a lot of people, the first question that we have to decide is, do we tell? Do we tell our young person that they have a diagnosis? And that really is the question. And that's not something that as a professional I can answer for you. That's a family decision. And every individual family is different. I am a big advocate of providing information, disclosing to the school, but there have definitely been situations where families have taught me that there might be reasons not to do that, particularly cultural type situations. So just realize that we're not here to tell you this is the way to do it, but help you think through if it's the right thing for your family, and then if so, what do we say and do? We'll help give you some ideas there too. So let's first talk about why we don't want to talk about a diagnosis. Typically, this stems from some fears, and that's okay, right? Fear helps us be vigilant. It's not necessarily a bad thing. So the things that we worry about are, this label, the idea of labeling a child, putting them in a box, maybe hurting their self-esteem, making them think less of themselves. Well, what if we tell them, they have ADHD, then they won't think they need to pay attention in school? Or, well, what if we tell them they have autism spectrum disorder and then they won't want to have friends? What if we tell them that there's an intellectual disability? Maybe they'll stop working hard in school. So lots of these sorts of fears that can get in the way. And we're going to talk about the fears, and then I can tell you what I have seen happen. I can't predict the future. Unfortunately, I have not yet figured that one out. But if somebody here has, I will pay you to help me out. So we can't, we can't with 100% accuracy say what is going to happen, but I can tell you with what I've seen over the years and the experiences that other families have had. So now the other side of things is, why would we want to tell? Why would we just not keep it secret? Well, let me ask to self-reflect here for a second and think about something that you're just not very good at. You don't probably like doing it. It's not your strength. And I want you to think about the words that you use when you talk to yourself or someone else about whatever that is. So for example, I'm a bad speller. Okay, and if you know me, you'll know that actually is true. But think about what I said here. I'm a bad speller. That's sort of an internalized process. Like there is a thing called spelling and I'm not good at it, right? If we don't have an external reason, like there's a physical disability that makes it hard for me to write, and that's why I don't write the words well, or a learning disability, the tendency is to kind of internalize that I'm not a good speller, I'm maybe not a good student, I'm maybe not very bright, I'm maybe not going to amount to much. So when we internalize these traits or characteristics about ourselves, there is a potential for some harm. And I've found that having an external reason that things happen, like if we're doing therapy for anxiety for children, for example, we may have them label their anxiety, like the worry monster. So it's not that I'm a worrier, the worry monster gets in my way of being able to talk to other people. When we externalize some of these things, it can actually help maintain self-esteem or even increase, self-awareness, because just like there's some things that are challenging for me, there's also some things that I do really well. So we want to also empower our young people, our children, to be able to be advocates for their own needs, right? So we want them to be able to approach a teacher or an employer, a colleague or a friend, and be able to say, in meetings, it would really help me if we could slow down, or someone else could share their notes, or I could audio tape them. Then I could go back and I'll remember everything that we did. Just being able to hear it and remember it, I'm not very efficient with that type of learning or with that type of memory. So when we help these individuals know about themselves, we can help them, empower them to be advocates for their own needs. And really, it's a solid understanding of our own strengths and weaknesses that probably led most of us to where we are. So, for example, I happen to be a little error prone in arithmetic. I learned very quickly that accounting was not a good line of work for me. You know, I have to pay somebody to do that because I'm prone to making little arithmetic errors that take hours to figure out and find. And so it's that kind of knowledge of my own weaknesses that helped push me in a direction for things that I do enjoy and that I am good at. So those are all important factors to consider. And I do think it's really important because one of the things that I see a lot are young people who are pushed into kind of vocational training settings, situations that are not ideal for their skill set. And if we can start developing, learners who have a good understanding of their own strengths and weaknesses, they can also advocate for their needs. Oh, fast food, that's a fast-paced, busy environment. And I tend to work best in slower paced, quieter environments, right? So we can even help them to be able to identify those things. So when I first started getting approached by parents saying, my kid's asking about autism, my kid's asking about ADHD, what do I tell them? I turned to the literature. And so this was a little bit longer ago than I'd like to admit, but there really wasn't anything out there about talking to people about autism or other kind of invisible diagnoses. There were just one or two studies, and they tended to include individuals who had physical disabilities, which in my opinion is a different type of do we tell, right? Because you probably can't hide a wheelchair forever. Eventually, that individual, the people around that individual will recognize that the wheelchair is a difference. But in an invisible disability like autism spectrum disorder, ADHD, OCD, PTSD, things like that, you may actually be able to hide it from that individual for quite some time, either intentionally or unintentionally. Right? So their literature on physical disabilities was, of course, seems very sensible. Talk openly, talk early. Yes, talk about differences. Do not pretend that wheelchair is not in the room. Definitely discuss it. If you have inclusion classes where there is a child with medical equipment, often that is kind of a topic of conversation when that child is introduced into the classroom. Other children have questions. Literature on adoption was another place that I looked, because you may know or remember that it was once thought not to tell children that they were adopted. We'll just hide it and pretend like it never happened. Well, the idea was to help them be adjusted and to help them feel a sense of belongingness and to help limit any distress they might feel. But unfortunately, the opposite happened. Adults grew up feeling like they were missing something, feeling like something wasn't right, like it was out of place, like they knew. And then when the instances where individuals are told later, there's often a lot of big feelings and sometimes drama that comes with that. So that literature that did exist was definitely suggestive of, let's talk about this. Now, more recently, there has actually been a lot of work done on talking to individuals about diagnoses, particularly invisible diagnoses. Also talking to other people, talking to family members, disclosing at work. So now there are a lot of resources that you can turn to. to get some more valuable information. And so most professionals do agree that telling the child does empower them. It does help them to be their own advocate. The benefits do tend to outweigh the risks in most cases. Now, again, that's not every case. So if your situation is different, we can certainly respect that and appreciate you being here and, work with everybody on the level where they are and with what makes sense in their family. But I wanted to share with you a couple of the responses. And these are typical of the types of responses that adolescents and adults, even some young children, give when they learn about their disability condition. Okay, perfect. So, oops, skip ahead. So from this one, what says that makes so much sense. This was actually a 9-year-old whose mom showed him, I think it was a brain pop video about his disability condition, and he watched it, and his response was just, overwhelmingly reassuring of her and affirming of her choice. He said, "Oh, this makes so much sense." He'd been starting to come home from school and say, "Why are the other kids mean to me? Why doesn't anyone want to play with me? Why don't I have any friends?" When brothers and sisters were going to outings and doing things that he just wasn't doing. So when he had an external reason for that, like, oh, there's a condition, there's a reason. I'm not crazy, bad, dumb, mean. This makes sense. So an adult told me also that when they learned and were told they had Asperger's syndrome, I felt normal for the first time. I knew I wasn't the only one. So, think about that. Think back to your childhood, your adolescence. There is a point in time where most people feel like no one understands them. That's kind of part of the developmental process, right? Is I'm this unique individual and I'm different from everyone else, and I have my own thoughts and feelings, and mom and dad, my family members, siblings, they don't all get me. So probably most people experience those sorts of feelings, but now, imagine if you really are the only person with depression or with ADHD or with Asperger's, autism, Down syndrome, right? So then it does feel probably really alone. I see, why am I the only one that goes to speech? Why don't the other kids in my class go to speech? So our children notice these things, these kind of unspoken differences. And when we can give them this external reason, it can help them not internalize it. Okay, so we're not going to show the video clip today because I've also learned streaming video on a Zoom call can be hit or miss with the technology and the bandwidth. But you may have seen the series called Parenthood. If you haven't, you can probably find these clips online, but I put the season, the episode, and the timestamp here for you if you want to look it up. So in this little clip, it's just an example of how children sometimes find out accidentally about a disability condition. Okay, so here, this boy is kind of on the stairway, and his parents and his uncle are kind of disagreeing about the support that he needs. And the dad says, "Why don't you get it? Your nephew has Asperger's. Asperger's, I tell you." And well, the kid was standing right there, and that wasn't a word he'd heard before. So, your kids will often find out that something's different. They're gonna see ARD paperwork, hear about it. Someone at school might say something. I formerly worked at a school for children with special needs where I taught middle school. And let me tell you, the kids talk about it. So why are you here? And I think I have this cute quote later. But they will talk about it. So even if the teachers and the staff don't, even if you keep it off the t-shirts and out of the yearbook, word gets around. including in special needs classes, in public school settings. Oh, why do you go see Miss Smith? Oh, well, I go because I have dyslexia. Oh, Mom, do I have dyslexia? So the kiddos are going to find out, and we just need to think about, how do we want them to learn? Would you rather tell them, where you can sort of, help frame it for them, so that what they take from this is that they have a lot of unique features, and this is what makes the world neat and interesting, and every brain matters to society? Or would you like their peers to tell them? Because one thing we can tell you about peers is that that's
I think she froze, right?
not always the nice. For the sake of our talk, just
Hey,
move to the
Natalie?
idea that, yes.
Natalie, you froze for a second. I don't know if you remember what you just said, but you froze before you went to your next slide.
Oh, I see that. It says my internet connection is unstable. That's
Yeah.
bad news.
So go back to your previous slide if you could.
Okay.
And I agree about the children finding out. It's kind of like when it comes to talking to your kids about sex. Trust me, they will find out. So do you want your kids to learn about sex from their peers or from the parents? So I agree with you, but you might want to repeat that thought about them finding out.
Thank you.
Sure.
Yeah, absolutely. And when we tell them, we have this opportunity to frame it in a way that is not harmful, in a way that is empowering, in a way that helps them to see and understand, all brains are important, and all types of people are important to society. And, with these challenges also come some strengths. Here's some things that you're really great at, and that's also because of the, fill in the disability condition. So when we are able to talk with our children, we're able to frame it that way. When other children on the playground say it, first of all, they're probably going to use incorrect terminology, and they're not going to be friendly. So
Natalie, Nedra asked a question on this topic. Do you believe that helping children identify their disability helps them to come to terms with being different? Because these are things that they will feel about themselves.
Absolutely. Absolutely. And I, on a smaller scale, and we'll talk about this later, but on a smaller scale, these types of traits, or these things, facts that we're telling children about themselves, is not terribly unlike, wearing glasses, and the way that different people respond to that, or not terribly unlike, needing to take medication for a medical condition, needing to take blood pressure medicine. Different people react in different ways, but ultimately, being able to talk openly about it does help with acceptance. We do see that. So for the sake of our time together today, we're going to assume that we are choosing to talk about it, right? So again, I'm not making that choice for you, but just to keep our talk moving, we're going to head to, what do we say? When do we say it? And the big one, what if they don't get it? All right, well, let me tell you, first of all, they are not going to get it. And that's okay, right? That's all right. That's why we're gonna make a plan to help this be kind of a lifelong process. So when I have a group in person, I really like to show this video clip where the little boy from the picture previously, his parents get it wrong. And I think this is a great clip to show, because they get it so wrong. Most people are kind of chuckling like, okay, well, I'll do better than that. But you see the parent sitting here, and you can already see what's going wrong. Look at Mom's face. So she is kind of breaking the news like this young person has a terrible, terrible condition, life-altering, maybe even life-threatening. So she can't even speak about it with composure yet. And that's okay, right? This is her process, this is her journey, but let's not bring the little boy into it at this stage. And then dad, what he's about to do is actually jump right on top of mom's words because he notices she's struggling. And then they sort of disagree about terminology. Dad says, like, well, you have a disability. And then mom says, no, 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 it's not a disability. It's just a difference. And so when the parents aren't even in agreement, you can just see kind of, although it's scripted, Max's eyes are getting wide and he's really unsure what to think. So I like to have people brainstorm about what they could have done differently, what could go better. And then we'll give you some scripts of our own to sort of practice or use if they're helpful to you. But really, there's no age that's too old or too young. So we just need to use developmentally appropriate language if we're talking to a very young child. And developmentally appropriate language is going to be true no matter the age. Okay. So one thing that I do tell parents is wait until you can speak about the diagnosis with composure. Okay. So if you break down every time the word autism is said, it's probably not the time to be telling the child. Okay? And it's all right that the child doesn't understand it the first time. A lot of our children don't understand many concepts the first time we teach them, even if they're typically developing. So we just sort of start talking often and early. We don't want to hide or avoid using the diagnosis because that does sort of send the message, especially to children, that it's really, really bad. And so they might even have this idea that whatever is going on with them is fatal, right? And if that's not the case, we certainly don't want to imply that or have the children worry about that. So for example, just, saying like, well, you're special and special people like you. Do you remember the idea about that externalizing some of these traits? The "you're special" approach doesn't really externalize it. Okay, so I'm special and I'm a bad speller. Like those may not be related, but I have a disability in writing and I'm a poor speller. Oh, well, that's why. It's my brain's not efficient at spelling, but it's really efficient at these other things. So we don't want to kind of hide the diagnosis. Now, when you are introducing things, I don't recommend that you jump straight to the word disability because we want to teach and empower and have an open-minded child who hears all of the pieces of information. But we discuss this information very matter-of-factly. Okay, so just like any other difference, just like if family is getting divorced, if somebody were depressed, some people in the family wear glasses and others don't. The way we talk about adoption, the way we talk about diabetes, the adult in the house takes this pill, it helps their heart. These are just kind of matter-of-fact things. We don't generally say, oh, this is my blood pressure medicine as we wipe away tears. And we want to keep the same approach here. Okay. So actually, just your willingness to talk with your child often and openly reduces the anxiety. Just by opening that door, you've already done a lot of the work. Okay. So we try, and I say try, not to create a situation where you have to break the news, like where we haven't said anything. And it's not always that parents are hiding anything. Sometimes it's just really never come up. Guys, I give this presentation and I was in a situation where I had to break the news. I had an adopted child and we got a diagnosis and he had no knowledge of it. So we were in a break the news type of situation. So it does absolutely happen. Okay. Now, Max, the little boy in the video clips, his parents went to see a doctor, a TV doctor, who gave them some great information and a little script on how they might be able to talk to him. Now, in the video clip, you don't get to see the script. You just see that his parent says, that the doctor says, here, you might want to use this when you're talking to him. And everyone always goes, oh, but what did the paper say? So I don't know what his paper said, but I do have a script for you today that has helped a lot of families. Okay, so then Max's family takes it home and they're able to have a better conversation with him. It's brief, they're on the same page. Okay, they have a book or a resource for him, and then he goes, okay, well, can I go play? And they let him go. So it was really a nice example of, we don't do everything all at once. I mean, how many of us learn a new topic, new information all at one time and really learn it well? I don't know about you guys, but not me. I mean, I think about even like using Zoom. Think about COVID. A one-time session is not it. 30 minutes intense training on the benefits and the limitations of Zoom, and I'm not going to take much away. But being able to do these events with Judy and with different people, every other week, I learn a new trick on Zoom. I see a little difference here. That's definitely a more favorable approach just to anyone's learning. Now, our children with disabilities often have individualized education plans at school because they need some help learning. So we don't want to take a modality of learning that's not really efficient for anybody and then throw it at them. So we're going to take this approach of little bits of information a lot of the time. Okay, I also recommend this approach for sex ed. 1 4-hour talk is in one ear and out the other. But if we talk openly and honestly lots of times, over a long period of time, we have better retention. So I see a question here in the chat. Let's see. Just want to make sure I didn't miss one.
Yeah, the question was, what do you do if the child does not come to terms with their disability and is angry?
Yeah, and good question, Nedra, also. We want to make sure that the parents, not only can speak with composure, but with authority, that they have some education on the topic. And even if it's a disability condition where there isn't a lot of information that exists in the world, as long as the parents stay a step ahead of the children, it should be fine. Or, depending on the developmental age and developmental needs, maybe it's a learning process that they explore together.
So you're saying it takes time?
Yes. So, but it is important not only to have composure, but also to have some of the knowledge to be able to share. Mm-hmm. Now, for Nedra's question, what do you do if the child hasn't come to terms and they're angry? This is, again, not a one-time talk. Mm-hmm. So I think sprinkling information over time could kind of help reframe that. And then I'll show you in the end we're going to talk about some phrases that may come up where sometimes individuals will sort of blame something. This is a fear when I talk to a lot of parents or teachers. This is a fear that they have, is like, well, what if he stops doing his homework because he has, knows he has ADHD? Well, then we'd address that as if any child stopped doing their homework, whether they have ADHD or not, right? But we'll kind of address some of those. And I think in this situation that Nedra's talking about, some of these are some of those same kind of statements. So what I would recommend is little bits as the child can handle it, or as the individual can handle it over a longer period of time. And particularly in this situation, I'd want to be sprinkling in those little bits that aren't necessarily negatives. So, oh, wow, that is an amazing drawing that you have. You just have such a good eye for art and are so talented on that. Might be some of that autism that really gives you that good eye for drawing. I don't know. And then kind of moving past, so that when you have a child who says, well, I wish I didn't have X, Y, or Z, or I'm mad that I have X, Y, or Z, you can say, if it weren't here, here are some other things that wouldn't be here either. Maybe. We don't really know. Okay? And sometimes if there's an intense anger, or grief that's persistent, that may be a good time to involve some professional help to come to terms with that. So just like we have sort of, bereavement and loss that is typical, it's expected to be sad, grief after a medical diagnosis that has high risk, like cancer, or any other medical condition that might be life-limiting, we may expect some grief. We might expect some period kind of grieving the loss of normalcy or the loss of what we'd expected. But if we have this ongoing persistent, negative mood or negative feelings toward it, that might be time where some therapy could be helpful. Okay. Yeah, absolutely. And impacted emotionally by peers in the school setting. So when the peers make comments, yes, they can be super, super cruel. And at some point, that's, maybe where we can help and enlist the help of the adults, because it might be too much for a child to handle. Okay. All right, so when we do talk to children or individuals with disabilities, I prefer to avoid using words that already have a value attached to it. So I don't like to use words like good and bad. Well, you're really good at math, but you're really bad at spelling. Or, even things like, well, you do better in math than you do in spelling, or you do better on the computer than with real people. So all of these words here, I don't like to say. I think these words have value judgments that are just inherent in the word choice. And we need to leave that, right? Because we want to have a matter-of-fact approach that's driven by advocacy and self-awareness. And in order to meet those goals, we need to use words that don't have so much value attached. So I really like efficient and inefficient. And most people say, oh, but my kid doesn't know what that means. Perfect, right? Then that tells you that is the perfect word choice if they don't know what it means. So I like those words because you then get to teach what those words mean without the value. Easier and harder are also good because it doesn't imply that, well, this one you're not able to do and this one you are. Well, that is easier for you. Yep, and that's more challenging, that's more difficult, that's harder, but you can still learn to do it, or you still try your best at, right? So I do recommend leaving out the word disorder until the young person's understanding is quite good, because first we want to talk about the difference, and then we teach. And did you know there's some people who think this is a disorder? I mean, I know you have, you're so efficient when it comes to talking to people and making new friends, right? And it's a little harder for you to do the schoolwork. Things just aren't efficient when it comes to the math and the spelling. Yeah, and some people do think that's a disorder. But do you know what I think? I think that all brains are important, and even brains or brains with learning disabilities are particularly important to the world. And here's why. Right, so you have the opportunity to frame it. So we also want to talk about people that are famous, either now or in history, in people sometimes famous people who are successful are not tangible to the child. So if you're not already involved in, a support group or a meetup group for people who have children with your child's disability condition, definitely do that. And I hear a lot, oh no, what if he picks up the behavior of those other kids? Okay, he might, but he might also pick up the behavior of the kids at the neighborhood park. Let me tell you, I was there last weekend, guys, it's not good. So, there's a risk with everything that we do, but the benefit of not feeling alone, of feeling some camaraderie, of seeing, oh, I'm not crazy, weird, or stupid. This is a thing, other people have it, definitely outweighs the fact that they may come home, whistling or clapping. Okay. So I do then introduce the word disorder, and let's just talk about what, this is something that I've used. You can modify it. I didn't even come up with this. So you can modify it, change it as you see fit. But sometimes talking to young people, so first I start by just making observations. And that might be, wow, art. You're really efficient with art. You have a brain that is just wired for art, or whatever it is, right? So you just kind of start dropping those observations. I've noticed that even though making friends can be challenging for you, you are working so hard to have friends in your class. I'm proud of you. And you move on. So you sort of start pointing these things out just with observations. And it's important that it comes from you, because diagnostic criteria doesn't apply to your child. You know, that's in a more advanced level. Some things I've done in group therapy is actually have adolescents or adults on the autism spectrum look at the diagnostic criteria and talk about it. And they're like, this isn't me. You know, I have friends. I don't do that. And so you learn that the diagnosis does not define you as a person. So I like to let the parents kind of frame it. And then if you want to sit down and sort of really get this information in, you can tell them, you know how you find spelling really easy? Well, that's because when you spell, this part of your brain over here lights up. Guys, and I'm just pointing at my head, okay? Totally making it up. It's a really efficient part of the brain for spelling. And here's the thing, when I spell, this part of my brain lights up over here. It is not the most efficient part of the brain for spelling. So it doesn't mean I can't spell. It just means I have to practice a lot. It means I have to work harder at it than you do. Right? Now, when it comes to making friends, we're the opposite. You know, I find making and keeping friends pretty easy. And when I make a new friend, this part of my brain lights up, and it's really efficient for making friends. Now, you use this part over here. It's a little less efficient, and that's maybe why you find making friends more challenging. Doesn't mean you can't make friends, just means you have to work hard and practice at it. You know, that's why you practice with Miss Tiffany, or that's why you practice. So, you know, putting in, a lot of times kids will notice or ask about why do they go to therapies that other siblings or things don't do. And you can fill in these blanks with anything, you know, and it really can be anything. Making friends is not always the best example, especially for someone with autism spectrum disorder. Sometimes they make and have many friends. Other times, you know, if they're bullied and complain about not having friends, this would be maybe a good area to discuss openly. It doesn't help to pretend like a child has friends when they don't. You know, that just bounces right off of them and is one more way they feel alone. You know, I'm sorry it's so hard. I'm so sorry there's such mean kids in 5th grade. We're working on how to help those kids be nicer, and we're working with the school on finding good friends for you. Okay, so let's kind of address some of those what ifs. So one of the things that people fear, or that I have heard, thank you, middle school, you know, I can't do homework. I have autism. Okay, well, here's the thing. Like, autism and homework, they don't go together. You know, you can have autism and do homework. It's a pretty amazing thing, really. You know, I had a young man tell me that his disability made him hit. And we happened to be at the track, and there were like 3 classes of kids on the track, and said, you know, I can't, I'm sitting out because I hit. You know, my autism makes me hit. Well, you know, I see how you could think that, but having autism doesn't really have anything to do with hitting. You know, or sometimes you can make a choice to hit, but even with autism, you could make a choice not to hit your peers. Okay, so we just sort of address these as they come up, and I don't see blaming behavior on a diagnosis. I don't see this as a bad thing. I see this as a child trying to externalize maybe some choices that they're not proud of, or something that they wish they didn't do. You know, well, I didn't steal the cookie. That was my ADHD. Well, okay, maybe you got a point there, but and so we just have these opportunities to help them refine and learn, just like any skill. You know, you have a toddler that walks around and calls a kitty a doggy, and we have to refine that skill. No, this is a kitty. So sometimes you'll also see that individuals start diagnosing other people. This does happen. So actually, in my middle school class on the same playground, I had one student say, I know what your Asperger is. It's being oddly obsessed with weird bugs. And the kid was like, what? And what was happening is that one student was noticing a fixated interest of another student. Okay? So when you hear people diagnosing other people, we just respond like, well, because sometimes they may be right, is the other thing to consider. This doesn't necessarily mean that they're only pointing out people who don't have their or another disability condition. So I wonder, but it would be rude to ask, and we just kind of cut it off. Well, everybody has different strengths and challenges. It's not our job to guess why. Okay. So there may also be some kind of longing that, why me, especially on hard days, or if there's teasing or bullying, I wish it would go away. Why do I have to have a wheelchair? Why can't I run like my friends? And we want to think about this from the position that the child is in. I mean, would you tell a child who is dependent on a wheelchair for mobility, oh, one day, honey, one day you'll walk, if it's not true? And I'm not saying whatever it is that your child's striving for or asking for isn't true, but when they come to you saying this, they're in the state of mind that this is the way it's going to be forever. They're not seeing the light at the end of the tunnel. And if we just present them with the light, what we say actually bounces off and they don't internalize it. What we've said is too different from how they feel. And there's a lot of research on assimilation and accommodation that supports this. So if you're just the cheery side of things always, that's fabulous. However, I'll encourage you, if you have a child who's, sad or down, try this other approach. Try kind of joining with them in that emotion and offering hope or offering praise or, telling them that you're proud of them. We would not say, oh, honey, one day you'll walk. We'd say, I know this is hard and I am so proud of you for getting up every day and facing those kids at school and teaching people about your wheelchair. You were so brave. And so we'd let them know, this is how I feel about you, right? So I hear how you feel. Can I tell you how I feel about you? Is going to be a more heard approach. It's going to help move that child from kind of a negative place to a more positive place. If you just meet their negativity with super positive, it bounces off.
So the question was asked, how do you explain the differences on the spectrum for a child? Because we all know it is such a wide spectrum.
Yes. So I'd start with the child, and here's a caveat: do they have access to the internet? And that is a caveat, because if they have internet access, which most people do these days, and you think they're going to Google it, you may have to do a little more teaching up front earlier. Like, if you do some looking up, I need to tell you that there's a lot of people who have autism, and some of them are like you and some of them are not like you. And that's okay. We can talk more about those differences if you're interested. So just go ahead and plant that seed, because what you don't want is them to pull up a video, and let's say that this child, you've had a conversation with them and they pull up a video that is of a young person who doesn't have functional verbal language. I don't want that child to then stress that autism is degenerative and they're going to lose the ability to talk. Okay, and these things seem a little bit like silly to us almost, but when you're a child and you don't have any other knowledge except this little bit of information, what you see or hear from someone else, you're going to fill in those blanks, and it could be this way. When we do a longer talk and talk about what do you tell siblings, what do you tell classmates, what do you tell other people, one of the first things that I have people share is that the disability condition is not contagious, right? And that seems kind of silly, but there is a fear of children's that, like, well, if I sit next to that person, I might get that, I might catch it. Especially, you guys, that's going to get so much worse because of COVID. Where kids are learning about communicable diseases and they're not able to separate that out. And that's not mean thinking. That's not, discriminatory thinking, that's true naivete. That is just not knowing and trying to make sense of the world. So we have to give them the information. Okay. Feeling alone and misunderstood, same kind of thing. Definitely the joining. You don't get it because you don't have Down syndrome. You're right. But my experience is things do get better after school. Yeah, you're right. I don't understand. I don't understand what it's like to go and be bullied, but I would really like to try. Can you help me? Okay. So I have some of my favorite resources here, just for a variety of different conditions. And so take a look at those. The Kathy Hoopman books are great, and people say, oh my gosh, but this does not describe my child. Perfect. If some of the pages do and some of the pages don't, what a great conversation starter. And this Asperger's syndrome book does come with All Cats Have Autism now. They published it both ways. I had this All Dogs Have ADHD book on my coffee table, told my son, hey, the thing that you get some help at school for? Look, I got you this book about it. Take a look. 9 months later, my son, Mom, that dog book? I think I have that. I think I have that dog thing. So sometimes it takes a long time. Okay. Here's some others. This book is great. This Autism, What Does It Mean to Me? The older version is the red Asperger's. This is a lovely book. It says that it's useful for up to elementary school. I've used this book up through high school and even with young adults. So it definitely has information that's helpful to older individuals. I really don't like the title of Different Like Me, My Book of Autism Heroes, but it's pretty neat because it talks about famous people in history who had many symptoms of autism. And it talks about, this kid ran home from school and went and did his art. Didn't have a lot of friends, but developed beautiful art, and this is who he turned into. So you can look at their stories. Some of them, they did great in school and they had trouble getting a job, or there's usually a pro and a con, like just a positive and a negative in the story. And you can look at those and kind of talk about, well, what do you think, in this person's life, what do you think might have been related to autism? What do you think maybe wasn't related to autism? What was the good part? What was, what did you have to work harder at? Okay, so that's a nice one.
Will you be able to send me your PowerPoint? Do you mind me sharing it with the group?
Sure.
Okay, because
Yes,
I know
will.
people asked.
Yes, and then Brain Pop has some great videos on a variety of conditions, and they're always adding more. Watch them first. The autism one, for example, is a little bit better to show maybe classmates or siblings before the individual, because they do use the word disability a lot. And then you can always go to YouTube and look up videos, but please, please, please preview those first. Never just play it from YouTube, because there are some terribly depressing, but you might find like teen with OCD and think like, oh, this is perfect. But then as they start talking, they may really say some things that we don't want our young people to hear. Okay. And if you have any questions, feel free to reach out to me. We can cover some questions now.
So I'd be happy to. Natalie, thank you so much. That was exactly what I was looking for. You are a rock star, as I always knew you were. And so for those of you, because I want to be mindful of everyone's time, please, please, please fill out the survey. I put in the survey link and I will copy and paste it again. Please complete the survey. It's just a few questions. Toy, I'm so glad you liked this presentation. Our pleasure. Our next presentation is going to be November 18th. I've included that link as well. Boyd Handley, an attorney, is going to be talking about special needs trusts, your questions and what you need to know. A few questions for Dr. Montfort. When do you educate others about disabilities so that they may understand that it cannot be transmitted through touching or be in close proximity?
Yeah, I think this is a great question. I am a big advocate of knowledge. So I'm going to share that bias with you. But when I have, and it's so hard because of confidentiality in the schools, and that confidentiality is great. However, there are times when a simple conversation could help so much, alleviate so much stress for a child or an entire classroom or a teacher as well, that I'm a big advocate of that. So I know that, especially with COVID, they're not really letting people go into schools and say, let me talk to you about Billy. I think what I would ask for is if you're able to send a note home, if you can contact some people in the class, and sometimes just being able to say, I understand that the kids in class have a question about Sammy's behavior. Well, Sammy does, flaps his arms when he's really excited. If you see him flapping, you could say, like, what are you up to, Sammy? What do you like? And just give them some things to talk about. I do think that with COVID, we're going to see more and more concern about things being contagious that aren't contagious. And so that is maybe important to delineate with, especially children who just have such creative minds, that, while COVID is contagious, this is not.
Yeah, I was always an advocate for sharing information and educating. And I would go in and talk to the classes at my kids' school, because you think they're not going to notice?
Right.
Of course they noticed. So another question, do they have coaches to help parents understand autism spectrum disorder to better plan for their child's educational and daily living paths?
We do, Nedra. So there's a number of different ways that you could get a service like this. One, family to family. Talking to other parents, talking to family network, there are some great resources. Then more specifically, if you need like a case manager to help make decisions and kind of see where a child is, some families don't know. If this is the oldest child, they may say, is my child really that different from other fourth graders? I don't know. And then it can be helpful to bounce ideas off of another person and even just hear what's worked for other people. So that is something that like a psychologist would be able to help with. I have some families that check in every 6 months. We just sort of talk about what are our goals over the next 6 months. How are we going to help you meet those goals? And then families, run free and do those things. I have also had young people and adults in therapy to help process and learn about a disability condition. So sometimes it may be that the parent says, I don't really know anything about this. I'm not very efficient when it comes to dealing with these issues, but I'm going to find you someone who is, and great, you guys talk about it. I've had families who do that. And I've also worked with young people who, I sometimes see this right at that transition to adulthood, when peers are driving, dating, and going to college. The individual that isn't meeting those milestones may experience a lot of jealousy. Now, not everyone does, and I talk to kids from a young age about driving. Well, can I drive when I'm 16? You guys, I tell my 12-year-old, who they tell me is physically and mentally capable of driving, I say, every family makes a different choice, honey. I don't know if our car insurance will tolerate another teenager, but that's a great, every family makes a different choice. That's how I answer the college question. That's how I answer the getting married question. That's how I answer the driving questions. Every family makes a different choice, and when it's time for you to be thinking about that, we're going to help you make the best decision for you. Okay. And we just leave that open. Does everyone need to drive to be a successful adult? They actually don't. What if you live in New York City? Very little driving. Okay.
Well,
So
I answered that question because I have seen where some of the parents have come to me and asked me questions when they've read the literature, or as what you were talking about, Googled a lot of things on the YouTube, and it just made them that much more confused, so that when they're trying to adjust to the child or adjust to the diagnosis of their child, then they're trying to make some plans. Okay, what do we do now? Okay, how do we incorporate this into our daily living, as well as trying to figure out some type of way to help our child progress?
I see.
So,
Yeah.
and that literature sometimes is good, but it's also bad when they come
Yes.
in such a terminology that if the parent is not educated on terminology, they're sitting there looking like, okay, I'm really now. So,
Right. No, I think you raise a really good point, Nedra. And in those situations, one thing I do is really try to take a moment and empower the parent. Because one of the things that I think is true in these situations is often that the parents that I'm interacting with who are going, what do I do? How do we live with this? They may not know the disability, but they know their child. And so we use that. You know, we say, hang on, this information, this is still the same little Billy that you had yesterday. This is still the same little Billy that you had this morning. You just now know a new piece of information about him. So what we want to do is start where you are, keep doing what's working, and let's, you know, make those changes and tweaks to what's not working. But if they've got a routine, if they've got some things working, I think you're right. We don't want to change too much at once. We don't want to overwhelm them. Just, you know, like we would not want to do that for anybody. So good point.
So you all have asked about the PowerPoint and a recorded presentation. Yes, it will take me a day or two, but please, please complete the survey. I have included the link again. Please complete it through SurveyMonkey, and I will be happy to send you the recorded presentation. I'm getting a little bit better each time at recording them and sending you the YouTube link. So yes, I will be happy to send that to you. I think we're pretty good on, I think I covered everyone's question. If I didn't, please chime in or put it in the chat box. I'm happy to know that even before I met you, Natalie, I was doing everything pretty much like you said. Yay!
I'm not surprised.
Well, I don't know. Sometimes I wonder, but you know, I think that it's just really, really important that, you know, you have to be straight with your kids. And just because your kids have a disability, that doesn't mean they're not aware of things.
Right.
And I think that sometimes parents associate a disability with our kids being, or our students or patients being unaware and clueless. Please don't make that mistake. And I think that sometimes they do, and they're sadly mistaken. And you do have to use it on their terms. I know when I had to explain about divorce, it was mom and dad had problems. The problems couldn't be fixed. And we're not going to live together anymore, but we love you and this was not your fault. Over and over and over again. And yes, we are getting divorced, and we used that word because we knew they were going to hear that word over and over again.
Absolutely. You know, and there's other kids in your class whose parents are divorced. There's other
Exactly.
kids like you who have divorced parents.
Exactly.
You know, divorce is hard and it may not be fun, but there is something kind of neat. You get two houses. You know, you have two bedrooms.
Yeah.
So I mean, or you know, or you have people in different states who love you. You know, there's always some little bit of a silver that can go with that truth, just to help them, you know, oh yeah, that is kind of cool. You know, I don't get to see dad regularly, but two people in two states love me. You know, just whatever it is that you help them frame, like, and how we would with anything with a child. I think divorce is a great example. You know, we would never like pretend.
No, and I never said
let's not talk about it.
Exactly. And it was just, we had problems and the problems couldn't be fixed. And you just say it over and over and over again. And when it came with the disability, everyone has to choose their time. And like you said, some people choose not to, and that's okay. That's your choice. You just have to remember that eventually your child will wonder. They'll figure it out on their own. They will Google it, or someone will tell them. And you just have to be really aware of that.
I'm so thankful now because I'm of the older generation. So a lot was not known, as you were talking about, Natalie, as far as the information and literature. They didn't know anything about it. And so when it came to trying to explain to parents as well as to child about the disability, you was pretty much left to your own devices. And so today I can honestly say I've learned more in my old age of how to handle myself. I'm actually having to explain a lot of it to my children and to my husband, because they were like, well, we knew you, but we just didn't know. I said, well, unfortunately, I'm getting a late start on self-advocacy because I just didn't know what to do and how to go about it. My family didn't know how to interact with me at that time, because once the diagnosis hit, it's like everybody treated me differently. It's like I had the plague. Nobody wanted to talk to me. They didn't really interact with me. And I, not knowing how to handle the diagnosis, like, okay, what does that mean for me? How do I talk to them? What do I do now? So it was really awkward, to where every time I'm interacting with my family or something like that. So I think I had a bad case of detachment from people for a long time, because the fear and what type of reactions I was getting. Because one of the things you talked about was the invisible adaptive equipment, so they were seeing all the different type of contraptions that be onto my head. Some of the peers can be cruel, some of them are scared. So it's really hard when you're not educated and you're not prepared, because it makes it hard on the child to try to adjust to what's going on with themselves when they have no clue, and the parents, the people they're looking to help them, guide them through it, don't know either. So it makes it not
Very
a good
hard.
situation. Yeah,
Very,
not
very
a good
hard.
situation at all.
It was very difficult
thanks
for
for
you, I'm
sharing
sure.
that.
Very
Yeah.
hard. Well, Natalie, thank you so much. Thank you. And you all
Judy.
have her contact information. Please send me your PowerPoint and I will forward it to the group.
All right, I'll send that today.
All right.
Thank you, everybody.
Thank you so
Bye-bye.
much. All right.
Thank
Bye-bye.
you. Bye-bye.
Bye.